Thank you everybody for attending today, attending this town hall. There's been a lot of questions about the coronavirus, COVID, what it means, what's our new normal. And today we'll attempt to answer some of those most burning questions. We've got an esteemed group of panelists who are joining us today. And I want to, first mention all of them and then welcome our first guest. But we are happy to share that we've got Senator Dick Durbin with us today, Congresswoman Robin Kelly, Dr. Emily Landon, an epidemiologist. I know everybody's becoming quite familiar with that tongue twister. We've got State Representative Sonia Harper, State Representative Lamont Robinson, State Representative Cam Buckner, Felicia Sanders, Network Chief for District 9 for Chicago Public Schools, James Burns, Program Director at the Kennedy Forum, Bill Lowry, Commissioner for the 3rd District in the county here in Illinois, and Ivy Hart, Women's Business Development Manager with the state of Illinois. And I think that's everybody, but quite a list. And we're just going to spend some time with each of them answering, giving them time to give kind of a brief overview of what they see as kind of how they're addressing this issue or how they can add value to the COVID pandemic that has taken us all by storm, to say the least. So without further ado, I'm going to bring online Senator Dick Durbin. Senator, are you there?
That's me.
Okay, well, welcome to this virtual town hall, Senator Dick Durbin, Minority Whip, who's just been doing amazing things, advocating for not only our state, but just for resources in general across the country. Senator, we appreciate everything that you're doing. Tell us just a little bit about what's going on the grounds as you see it.
Well, first, let me thank you, Alderman, for calling this town meeting. I did a Facebook Live last Friday with about 12 hours notice, and there were 1,000 people who called in with questions. And I thought, well, that's a pretty good turnout. Within the next several days, 50,000 watched it. So, I mean, people are anxious for information. And I want to salute you in your ward, in the 4th Ward, for this virtual town hall, because there are lots of questions out there, and it's the only way we can get to people. I thank all of your participants, and I believe you said Dr. Landon, who might have been called in there a little quicker than she thought. But thank you for letting me join you today. So let me go through it very quickly in just a kind of a skeletal outline, and then if there's any part of it you want to get into, we can do it. So we got into this negotiation. This is our 3rd bill since the coronavirus became a serious issue. And the first bill, the president asked for $2 billion, $2 billion. And we said it's not enough, and we raised it to $8 billion in a matter of a week and passed it. And then we realized immediately $8 billion wasn't enough. So we had a second bill for $100 billion, and we passed that within 10 days and quickly realized that was not enough. And we were facing a major challenge in this country. And so in a matter of a week, we put together a bill for $2.2 trillion, bucks. And we ended up passing that bill unanimously in the Senate, unanimously in the House of Representatives, and did it with Democrats and Republicans agreeing on it. Let me tell you the highlights. First, $120 billion to hospitals and clinics and healthcare providers. We believe that we've got to stop the virus if we're ever going to get this country back on track and our economy working again. And unfortunately, we don't have enough protective equipment. We don't have enough test kits. We don't have enough capacity, and we're moving as fast as we can. I hope I'm wrong, but I think we're probably 2 weeks away, 3 weeks away from a crest in Illinois. I'm just guessing based on what I've been listening to. We have a lot to do. I talk to the governor every day and the mayor every other day about what they're faced with. The governor reported to me today that at McCormick Place, which just might be in the 4th Ward, that
Yep,
at McCormick Place, it is? Well, he said he went down there and watched the construction of this 3,000-bed unit that they're building inside McCormick Place.
Yes.
And he said he was just amazed by what he saw. You might have been with him or at least heard about it.
No, I was there.
He said,
I've been there. Yep.
He told me, he said these workers and carpenters or others are running. They're not walking. They're running to get this done. They've got 500 beds done. They'll have another 2,200 done by next Thursday, and they're going to finish the 3,000 shortly thereafter. And that's just the beginning. We hope that's enough. So this first thing in the CARES Act, we call it, this rescue bill, is for medical providers, for hospitals, to make sure that they can meet the need here and keep their doors open and keep their healthcare professionals, God bless them, on the job. The second thing that we focused on was how to get money in the hands of people who need it.
Right.
The president said, well, I'll send a check for $1,200 for each adult, $500 for each kid under the age of 17. We said, great idea, Mr. President. We don't quarrel with you, but it isn't enough. And one check, one and done, is not going to do this. So we argued for dramatically increasing unemployment insurance, increasing the amount of payments over what the state ordinarily pays by $600 a week. $600 a week. And the idea is to make sure people can make their rent payments, pay the utility bills, pay the mortgage, put food on the table, and get by if they've been furloughed or laid off or lost their job if the company went out of business. $600 a week. We expanded the categories of people to part-time workers, the folks driving the Ubers as well as all these other cars, and we extended by 13 weeks the unemployment insurance that will be available. So that is kind of the first step in making sure that working families get some help. Now, what are we going to do about 50 to 60 million small businesses across America? Well, this was a powerful piece of this bill, and it was bipartisan. Rubio, Republican, Cardin, Democrat. I pitched in. Everybody pitched in. We were all for it. Here's what it said. If you've got a business with fewer than 500 employees, and that applies to not-for-profits, that applies to charitable organizations as well, fewer than 500 employees,
Right.
you can go and borrow your monthly payroll times 2.5. So let's assume your monthly payroll is $20,000. You could borrow 2.5 times that monthly payroll, $50,000, from a local bank through the SBA. And if you turn around and spend the money you borrowed on any of these things, payroll, benefits, utilities, or rent for your business, your loan's forgiven. You don't have to pay back that $50,000 if you can show you spent it on those things. Our idea behind that is to get these businesses to be able to get over this and be back in business when we start getting people out buying again. Now, there's help for bigger businesses, larger businesses by way of loans and a few grants, but the major part of it, I think, that we focused on was the small business part of it. Extra money for the states and the city of Chicago. We put in there that if you have more than 500,000 population as a city, and that's Chicago, or more than 500,000 as a county, that's Cook, that's Will, that's Lake, that's DuPage. Those counties, there's one more, I guess it's McHenry. If you have all those people are going to get direct federal payments. The city of Chicago is hurting. We know it is. It was before because of pensions. It's been hurting more because of what the city's spending. So this will be money coming directly back to the city to be used for the expenses they're running into because of this situation. There are many more parts to this, but let me stop talking. Senators never shut up if you don't give them a chance. So I just say,
Senator, we appreciate everything that you've been doing on our behalf. Just a couple questions. I know that people are concerned about resources. Are there enough resources? And what's our relationship with the president? Is that affecting the amount of resources that we're getting? What do you think? What would you say about that?
Alderman King, it depends on the day of the week. I listen to this president. One day he is complaining about our governor, about our mayor, and the next day he's helping. You can't tell where this man's going to come down from day to day. And in terms of whether we're receiving everything we need, no, we need more. I just talked to the governor. We need ventilators to keep people alive if
Yeah.
they're struggling with this COVID-19. We need, masks and gloves and gowns and things that keep the healthcare workers safe. Definitely need those. We need more beds. The 3,000 beds at McCormick Place in your ward are going to be critical. We may need more down the line. Every hospital is trying to figure out how to expand this, and we're trying to figure out innovative ways to do this. But, some days I think this president's doing the right thing, and some days I just don't understand him. He talks about Easter, it's going to be all over. That's just crazy. That's not true. He's changed that story.
He's sounding lately like he just found out that this, was a pandemic. But I agree. It's hard, day to day. But it's nice to have people, with some seniority in our state. So we thank you for that. Another quick question around resources again. The timing of the resources. So people were told about resources going directly to their checks. To their personal homes that would lag a little bit if they didn't have bank accounts. Do you have any idea about when the resources will hit kind of individuals and when resources will hit kind of municipalities and for reimbursement and things of that nature?
Well, they're making big promises. It's going to happen this week or next. Most of these things are going to move. And the money for the unemployment insurance is going to be sent to the states by the end of this week. So the question is whether or not the Bureau of Employment Security for the state of Illinois, which will manage all this, is up to the challenge. And I tell you, I don't want to be critical of them because this is coming at them faster than they ever could have realized. Right. It may take some time to get it right, but the federal government is trying to move the money out. There's a question I had when I did my Facebook Live last week that came in from several senior citizens. Question was, Senator, if I'm getting a Social Security check, but I didn't file an income tax return because I didn't have any other income last year, am I going to get this cash check? And the answer is yes. And they announced this week, the Treasury Department announced they were going to send it to the same address where you receive your Social Security check, which could be banked for you if that's the way you do it, or could be mailed to you. So in this circumstance, you're going to get it the same way. So it sounds like that question is asked and answered in terms of whether you needed to file an income tax return last week. And can I mention one other thing? I didn't even touch half of this bill. There's so much more in it. But if you got questions and you want to know more information, my website is durbin.senate.gov, G-O-V, durbin.senate.gov. And we try to answer questions as they come in, so you might see the question you want to ask on my website, and we'll keep putting more and more information in there so people can keep up with it.
Well, Senator, we appreciate you. If I know your time is limited today, if you can hang on just while Dr. Landon is on, in case some other questions you may be able to jump in.
Okay, sure, I'll do it.
But we will go to Dr. Emily Landon, and as I was saying before, the word epidemiologist has become kind of second nature for the general public here, Doctor. Did you ever think that would happen?
It was bound to, I guess.
Yes, but we appreciate it. I'm glad that, I can say it quickly 3 times now. And we appreciate having you here today. And I know you are in high demand. So thank you again for joining us. But, can you give us just kind of a quick overview on what we should be doing as, a country, as a state, and as a city, as this epidemic takes us over?
Yeah, so it has been a surreal experience for all of us, especially in healthcare. I know we all have different experiences of it, but it is absolutely, it's something that I kind of thought, you do these preparations, these tabletop exercises, but it just doesn't, it pales in comparison to the real thing. Yeah. And it's, I know we all feel like there's been a train coming at us, and we're doing our very, very best to get out of the way.
Right.
There have been 6,980 cases in Illinois as of today, 715 more today, and 146 deaths so far. But the good news is that the forecast we're looking at for Illinois is looking better and better every day. I think the senator was right that 2 to 3
I don't know if we totally lost feed. Can you hear me? Matt, can everybody hear the doctor still? No? I think we lost her, but can you hear me?
Yes.
All right, so we'll try and get Dr. Landon back on. But while we're waiting for Dr. Landon, why don't we, move on to our next guest, who is, probably equally been inundated with questions just about, what are we doing in terms of education. We've got a CPS chief, Felicia Sanders, on a call. Can you hear me, Ms. Sanders?
I can. Can you hear me, Alderman?
Yes, I can hear you.
Great.
Thank you for joining us, and thanks everybody for dealing with technical difficulties as we get to used to our new normal. Everybody's pulling on the internet, and I know things have been crashing, but Dr. Sanders, I know that we, Dr. Janice Jackson, the mayor, have talked about going to e-learning. We've talked about, feeding students who are needy. CPS has taken on a kind of a whole new set of issues, as if, just educating our kids wasn't enough. But what I will say is there are a lot of parents that appreciate teachers a lot more these days, because I get all kind of funny texts about, how they're homeschooling and how that's going on. So a little humor in all of this. But, give us kind of the landscape of how you see CPS handling this issue.
Okay. Thank you, Alderman. I certainly want to begin by thanking you, Alderman King, for your tremendous leadership in the 4th Ward and for hosting this town hall tonight to provide information to your constituents. And I absolutely have to commend the CEO of the Chicago Public Schools, Dr. Janice Jackson, as well as our Chief Education Officer, Chief Latanya McDade, for their exemplary leadership during these extremely challenging times.
Yeah.
Since our schools have been closed, we have distributed more than 2 million meals, and that's an average of about 30,000 meals per day to our students and our families. And next week, while it is spring break, we will have 100 food distribution sites open, which we normally are not open for spring break, but in light of this crisis we're dealing with, we will have over 100 schools open. And if you go to our website, cps.edu, you can find a flyer that lists all the schools that will be serving food next week. So we're really happy about the fact that we've been able to be a benefit to our families. Certainly, we are fortunate to have committed educators and administrators in our city who are working together with our district leadership to provide quality educational experiences for all of our students pre-K through 12th grade. For the past 2.5 weeks, CPS principals, administrators, teachers, and other staff have done an outstanding job working together, embracing our current reality and our new normal for right now by keeping students engaged and parents informed. And as you referenced earlier, Alderman, all of our schools are preparing what we were calling a remote learning plan. This plan will begin April 13th, and the goals of the plan are to provide students with continuous learning opportunities that reinforce critical standards. The goal is to minimize instructional loss and to provide routines and structures to help students stay engaged and connected, and to attend to our students' social and emotional needs. And certainly this plan will not in any way replace the classroom learning experience or completely bridge the digital divide in our city. It is a purposeful effort from the district to empower our educators and provide them with resources they need to engage students in high quality learning experiences. The plan is definitely not a one size fits all. There was definitely a template for principals and their teams to use to work together. But we asked each school community, because they are also diverse and different, to craft a plan that would meet the needs of their students. And so families will be notified of these individual plans April 6th. And again, the plans will begin April 13th. And included in the plan will be both digital and non-digital learning options, as well as dedicated office hours where students and families can receive support from their teachers via Google Meet, phone, and email. And while students are expected to complete the assignments and schools are able to grade work, grades will be counted only if they improve a student's grade. They will in no way hinder or impact a student negatively as it relates to overall grades. So we really want to express that. We want the students to do a great job, but there's nothing that will happen in the remote learning plans or during this time that we're closed that will negatively impact the student.
That's great to hear. Dr. Sanders, just if you might, can we ask just a couple of questions?
Sure.
Especially since the e-learning will be new for the district. How do you see kind of the virtual learning being conducted for students in general, but especially students with minimal resources? What are some of the things that we're doing to make sure that they don't get left behind in this even larger digital divide, I would say, that we've all had to become accustomed to so quickly?
Well, a couple of things that our district leadership has put forth. Many of you may have heard the announcement that we're going to be deploying over 1,000 technology items to families, and the district leadership is going to provide guidance to the schools on how we're going to do that. But there were over 65,000 computers or technology items that we currently had, and 37,000 more have been ordered. And so schools are going to receive particular guidance on how to distribute that, so the individual schools will notify their families as to how and when they can pick up technology. And one thing, as equity has been such a force and a focus for CPS this year, we are definitely looking at the areas where the need will be probably greater than other areas to make sure that our students can receive the technology that will assist them. And in addition, Alderman and everyone listening, there will be non-digital resources available as well. So even on our website right now, a parent can go and find grade level materials and activities and instructional supports for their students at home if they don't have a computer or choose not to use one.
Sure. And I'm sure, in listeners and people who have resources, I'm sure the district would also be open to donations of digital devices so that our kids can make sure that we have those. Is there a place that we can get those to, or that people can, provide resources to in particular?
You know what, Alderman King, anyone, and we absolutely welcome support from the philanthropic community. And our hotline, 773-553-KIDS. Anyone who wants to make a donation, please contact that hotline. Again, 773-553-KIDS or 5437. They can contact that hotline and they will receive guidance on how they can make their contribution or their donation to the Chicago Public Schools and our students.
Great. Let me just look at a couple of questions from some of the folks in our audience.
Okay.
There's a question here. There's concern there will be a lot of social promotion because of COVID-19, since there may be limited capacity to truly assess the learning of the students. How will this be prevented from happening?
Well, one of the things for sure is that our Illinois State Board of Education is giving all the districts in the state guidance around those kind of critical areas. And I will say that that's one of the reasons that we're really, really promoting the remote learning plans to keep students engaged so that we can continue the learning, because during each day, teachers will be engaging with students, providing mini lessons, and they will be uploading lessons for our critical areas, literacy, math, science, and social studies for sure. So they're going to be engaging students, and students will be still asked to complete assignments. And if by chance a student is not able to or does not, a student can receive an incomplete until such time that we can come back together and really look at their experience for the year in totality. So I know some people think about social promotion, but we're really committed to working hard with students to make sure that we keep the learning going so that they really can receive the content that's grade appropriate for this year so that they'll be prepared for next year.
Well, that's great to hear. And speaking of great things to hear, there's a comment, not a question, but it says, Chief Sanders, the Greater Brownsville Community Action Council stands with you in schools in Network 9. We look forward to reporting out to you the efforts we have attempted to supplement the work of the district. And as you and I both know, that particular CAC is very involved and just doesn't, ask, what can you do, but what can we do? And so we appreciate that. And I thought it'd be nice for you to hear that feedback.
Thank you.
And then one last question, and in terms of students with special needs, it's obviously folks who are disproportionately impacted by any type of resource challenge. Has there been a special look to what we'll do for students with special needs?
Absolutely, Alderman. We have definitely put forth guidance to all of our school leaders to continue to make sure that the focus that we currently have for our diverse learners and our English learners, for as far as that goes, will continue to be reviewed, and the teachers will still be co-teaching and co-planning, and our DL teachers, all teachers will be working with our students, and our DL teachers will as well. They will convene with their students virtually, as the rest of the students will, and we really, really want to make sure that they are working together, because we want to make sure that the specific needs of the students as determined in their IEPs will be met. And so we are confident that our principals are leading our diverse learner teachers and our English learner teachers to make sure that they're going to be providing that high quality instruction as well. So we really believe that all of our children will receive what they need from our amazing teachers in the Chicago Public Schools.
Right. Well, thank you, Ms. Sanders. Before we go back to Dr. Landon, who I know is back on, I just want to say thank you to you and all that you always do, and thank you for being on this panel. Hang on as long as you can, because there may be questions that come up specifically around education. But I also wanted to take the time to shout out the CEO of Chicago Public Schools, Dr. Jackson, for the work that she does. When I say that we've got a gem on our hand, Dr. Jackson is one of the best administrators I've ever seen, hands down. So Chicago Public Schools is in good hands. I know that, as anybody else, they need resources during this time, but they certainly have great leadership. And so I appreciate that. Dr. Landon, I'm so happy to see you back. I know, there's a lot calling on technology these days, so hopefully we can keep you on long enough to hear some of the good information that you have. And I know you got interrupted, but feel free to pick up where you see fit.
I'm gonna go back to where I was gonna go next, which is social distancing. It's so hard for all of us. I mean, I'm here in my living room talking to you now, and I do go into the hospital occasionally, but most of my administrative work for the hospital is done from home now via Zoom meetings, just like this one.
Right.
It's hard. It's not easy. And I know it's really gotten in the way of a lot of people's livelihoods. People are losing jobs. The jobless numbers are unbelievable today. And I could not be happier to hear from our politicians, people like you, people like Senator Durbin, and I was on a town hall with Senator Duckworth earlier this week about putting our small businesses, our gig economy, and people like that on the same kind of life support that we're doing when you get sick needs to be done for people when they have to be social distancing. That we need both in order to get through this, and I'm so pleased that they're doing that. So keep up the good work. But I also want to bring up something that I think is kind of important that we don't talk about enough, and that's these essential services, these people that are still going to work, like many healthcare providers at the University of Chicago and at every other healthcare setting, and at distributing school lunches and working in grocery stores. We cannot make these essential services mean that we are essentially giving up on them staying well. And
Right.
it's so important that we find ways of doing social distancing even at work. University of Chicago Medicine has a great plan in place. We have one examiner per team. We only allow teams of physicians to round together, as a team like this. Only one person in the room at a time. No one hanging out on floor workrooms. Communication has to be done from 6 feet away or greater. And we've really cut back on the number of people that are in the hospital in order to make sure that the people that are in the hospital have enough space to be safe. And so that's really something that I would encourage all of the listeners that are involved in essential services to think about doing in your own places of work. Anything you can do, moving a workstation 6 feet away can make a big difference in terms of exposure, that sort of thing. I also want to talk about testing and if you do get sick, because we have seen, we've had over, at the University of Chicago, we've done 3,345 tests in the last 30 days, and 437 of those have been positive. So that gives you a good idea of what's happening in the Hyde Park neighborhood. Certainly there are people who are getting their care elsewhere and having test results elsewhere, but that is the numbers that I can give you about what's happening right now. A number of those have been in the past days because we are sort of getting to the point where we're seeing a lot of positives every day. There's clearly transmission happening in the community, but it has slowed a little bit since we had the social distancing put in place. It can take a couple of weeks to start seeing a difference in the number of patients admitted to hospitals. And because we're so limited on the number of test kits that we have and the number of swabs that we have, we really need to count the number of patients admitted as our baseline, because we're just not getting a good feel for what's happening in the community. I know people really want more testing. I want more testing as much as all of you do. But the swabs that we usually use for this are made in Northern Italy. The kits themselves, the reagents are very difficult to produce. The tests are not great tests and should not be used in asymptomatic individuals. So after you've been exposed to someone, if you're not sick, you should not be getting tested. That's a bad use of a scarce resource. And so we are reserving our tests largely for healthcare providers because they have significant exposure, and we need to know if they're sick before they take care of patients. And then also patients that are being admitted to the hospital because we don't have enough PPE. We have to know who has it and who doesn't so that we can use the masks wisely to protect our healthcare workers. We really are short, much more than I anticipated we would ever be, even in this situation. We knew it would take a while in the beginning of a pandemic for supply chains to open up, but this is just it's not happening the way any of us anticipated in all those tabletops. Right. So I want to thank the community members who've donated things. The university has donated a lot. A lot of the scientists there have given us PPE. A lot of our community partners have, but we are being the best stewards we can of what we have, because many of our healthcare providers live in this area, and we are doing our absolute best to keep them safe. That's the best that we can do, and we'll protect you if you come to us as a patient. There's a lot of telehealth options at the University of Chicago and everywhere so that you don't have to leave your house to get care. These are great. Thanks to some work that the governor did, we can now bill for those so that we can be able to ask your insurance to pay us for taking care of you remotely, which is good because it'll help us to be able to continue to serve the community. And our ER is doing great. We've expanded our capacity. There is room in the ER for people if they get sick and need to come to the ER with COVID. If you're well enough to stay home, your best bet is to call your doctor or your primary care provider and use the telehealth options available to you to get the care that you need, and hoping that you are one of these people that gets over it in a week and you can get back to your normal life. If you do get sicker, you are welcome in our ER and in any ER where we will be able to take care of you. We have about 80 patients admitted now with COVID at the University of Chicago. We've cleared off 2 of our entire floors of that new hospital we built are just for patients with COVID now. And we have room. We can make more space. We have plans to expand. We have plans to add beds where we don't usually put beds. We can do a lot of things to help make room for more patients if we need to. So the last piece I wanted to say is just this, the healthcare workers are doing amazing job, the ones on the front lines. And if, you know, that they've started a hashtag campaign at the hospital, thousands of differences. So hashtag thousands of differences. If you send encouraging messages or artwork there, they will be displayed on screens that are shown to our clinicians all over the hospital. And it's been doing a lot to help boost their morale, to know they have the support of the community. So if you get a chance, post anything to social media with the hashtag thousands of differences, and we will get it directly into the eyes of our healthcare providers as they're doing their jobs.
No, our first responders are doing fabulous work. They're putting themselves, their families on the line. And so I appreciate you and everybody else who's doing, you know, their jobs, but certainly in such a way that, you know, right now with this pandemic, there's, you know, just a lot of uncertainty. So I appreciate their work. Just some couple of specific questions that have come up, a lot regarding testing. Obviously, you know, we don't have an unlimited supply, as you said earlier, but there's been talk, you know, about Abbott's kind of quick response testing. What do you think about that? How could that be integrated? Do you see kind of a larger swath of testing being done in the immediate future?
So we are cobbling together. It's not like there's just a massive, everybody's got one test like they do in South Korea, which I find to be kind of magical because none of the rest of us can figure that out.
Right.
Instead, we're cobbling together what we can. We've validated the use of just nasal swabs, which we can get because they're not made in Northern Italy. And we're trying to validate a saliva test because that doesn't require a swab at all. We have a 45-minute turnaround test. We have a less than 1 day, like 8-hour turnaround test. We can send to third-party labs. We can use the health department's thing, and we are using it to test as many people as we can. There are so many people that are sick. We still need a lot more tests, and that supply chain isn't. I don't know what it's going to take to open that up. The governor's asked that. We've told him what we need, and he's asked for what we need. The senators have asked for what we need. The New York's asking for what they need. Everybody's asking for what we need, but it just doesn't seem to be. It doesn't seem to be getting into our hands.
Yeah. So speaking of, you know, so many people being sick, I just want to kind of dispel or maybe educate folks on, you know, how this is passed. I mean, you know, I'll just be honest, you know, my husband goes to the grocery store now, and when he comes back, we're wiping down items. You know, I've heard recently that it could be on your clothing, and if you shake it, you know, the molecules could then spread. Can you talk to us and maybe either allay some fears or either kind of educate us on how we can mitigate passing this along?
Yeah, first of all, there's a lot of studies that are going to come out just like they would from any virus where they find viral particles in all sorts of places. But
Right.
We have to stop for a minute and understand that with every infection, you have to get a certain number of viable viral particles or bacterial particles into you in the right place at the right time, at the same time, in order to cause infection. We call that the inoculum dose, the amount that it takes to make someone sick. For some infections, that number is very low, like just a few organisms would be enough. For other infections, it's much more. For other coronaviruses, it's much, much more than what they're finding just ambiently in the air or on surfaces, not in a room of someone who is very sick with coronavirus.
Right.
So I think, plus we don't even know if those viral particles in many of these studies are even alive anymore. Just finding little snippets of the RNA of the virus doesn't mean it can actually infect you. And these viruses are they are not the hardiest of viruses. part of the reason that the test isn't perfect is because the virus can sometimes degrade completely before we even get to the testing, like to doing the actual test on the sample. So you have to have a lot there. So I think we need to know that the most important thing is to just keep your exposure as low as possible. I don't think that if you are at very high risk and you want to wipe down the stuff from the grocery store, go for it. If you are limiting, you're going to the grocery store once in a while, you're picking stuff, the grocery store is making sure not to have too many people inside at the same time. It doesn't appear as though there's a bunch of other sick people there. Keep your distance, take the measures that have been recommended to you. Certainly some healthcare providers, we are giving them guidance to do things like change their clothes when they come inside and put them directly in the wash. But they've been in a unit full of patients with coronavirus where we're doing all sorts of things to help them breathe better that spreads the virus even more. So that's a different situation than just going to the grocery store. And I think it's safe to go for a walk outside.
Great. Yes, outside today, the sun, I just looked
so nice, right?
And just soaked it all in, that natural vitamin D.
It's good for you.
Yeah. A couple more questions. Well, speaking of good for you, what are some ways we can, boost our immunity? What are some things that we can naturally do as we're sitting at home?
The hardest thing is the best thing. The one that has the most evidence is getting more sleep. So there actually is evidence that getting more sleep puts you at lower risk of getting colds in the cold season. And coronavirus makes up, a certain kind of coronaviruses make up 25% of the common cold. Now, this is a different kind of coronavirus. It's a beta coronavirus. It's a little hardier, a little bit more tricky, but there's no reason to believe it's not going to hold up. So drink lots of water, make sure you keep active at least a little, get plenty of rest. Certainly keep up with taking care of the rest of your health. Do not just throw your health out the window because you're so worried about coronavirus, because that's not going to help you. You don't need to start behind if you do get sick. You want to start optimized. Yeah.
And we're going to have James Burns just talk about kind of that psychological impact a little later. But that gets into it. So how about vitamin D and zinc and, some of those types of things? Or is it good to kind of vitamin C to kind of boost those in your system now, or is that just kind of overkill?
As long as you're not really overdoing it, it's probably okay. If that's the sort of thing that you do every season and it seems to work for you, then by all means, go right ahead. But you've got to be careful. Please do not start quadrupling your vitamin D dose without talking to your doctor. Don't start taking 5 new herbs that might interact with the medications that you already take. This is a time to ask your doctor what you can do to optimize your health. And they are available to you. They may not be in the office, but they can chat with you like this. They can talk to you over the phone. There are nurses. We certainly have a lot of clinicians who are ready to answer those kinds of questions.
Right. So another, kind of thing that everybody's doing and doing differently, and I just want you to shed some light on it. These masks, right? There's the coveted N95, and then there's, kind of the regular doctor's mask, and now you're getting people making masks out of the goodness of their heart, making masks. But can you break down kind of the level of protection or lack of protection for these different masks?
The best protection is an N95, but it's really only needed when you're doing these procedures on people. You're really having close contact with people who are very sick, undergoing nebulizer treatments, a ventilator, that sort of thing. And they should be saved for people who need to do that. We are short of those masks. We have a lot of some sizes and not a lot of other sizes. We need more of those masks. And it breaks my heart when I see people just walking around outside in them, because that's a mask that could be saving a nurse's life. And it's not on their face. And that is hard for me. The regular procedural masks, the medical masks, surgical masks, simple masks, whatever you want to call them, those are very good for protecting healthcare workers. And they're also good for holding in your own secretions. They're not great if you have to have prolonged close contact with someone who's coughing a lot, having a lot of problems, needing those breathing treatments. But they can be helpful. But again, we are short on those too. We need more of those, and they are much more useful in reducing someone from high risk to low risk than they are taking your low risk activity and making it a minimal risk activity. So before you buy up all these masks, please think about that. because they could be in the hand of a healthcare provider or someone who needs to do critical work.
Right.
I see questions about construction N95s. We are taking those in donation. If you have them, please give them to us if you don't need them. We're taking them. We're using construction N95s now. But the fabric masks, so cloth masks, we use them in the hospital. They are best. They provide some protection, but they are not perfect. The best thing they do though is they hold in your own respiratory droplets. So you know how you can give this illness to other people in the 2 days before you even know you're sick,
Right.
and it's terrifying, right? Because you don't even know if you can go visit your grandmother,
Right.
because of this situation. Those fabric masks are very good at holding in your secretions as long as you're not coughing or sneezing, and so that can really protect someone from what is called pre-symptomatic spread, that low level of spread that happens when you're not really symptomatic, and people who are asymptomatic but still positive. Those masks can be very good at holding in those droplets. So I think they're really useful. We're using them for our healthcare providers in all the situations in which they wouldn't have worn a mask before this, to make sure that if they get sick, they don't pass it on to other people. We are making a bunch of them today's one of my days off. I don't get them very often. This is my second one since January. And I am using them with my son. We have made a bunch of fabric masks this morning to share with family, so that they have some too, because we figured out how to do it without, there's great tutorials on the internet without even having to sew.
So in general, say the N95s for, first responders, people who are in constant contact with folks who may have the virus, but on a regular basis, the made up mask that people are getting are probably enough.
The tightest weave fabric that you can get is the best, and doubling it up. And if it gets wet and yucky, then just once it gets wet, it can get kind of contaminated. It's more likely to hold on to contamination. So you want to wash it with soap and hot water, and then wring it out or dry it in the dryer. Hot water and hot dryers are definitely great ways, silver bullets for coronavirus. So they will do a lot of good.
So one last question before we get to Mr. James Burns of the Kennedy Forum. And, you mentioned hot, I've also read about kind of hot tea and lemon being good. Is that, again, just wide sales or?
I'm not sure if it's going to make a huge difference in terms of your viral outcome, but it might make you feel better. My mom used to make that for me when I was sick, and now I make lemon, honey, and cloves and cinnamon and some tea and chamomile in there when I'm sick, and that's what I give to my son. So if nothing else, it's love, and it makes me feel better. And the placebo effect is not nothing. It's meaningful to do what feels good.
Right. It's psychological. And speaking of psychological, Mr. James Burns is going to share some things, but Dr. Emily Landon, an epidemiologist. Everybody say that quick 3 times. Thank you so much. Thank you so much for your input. And like I said, I know you're in high demand, so if you can hang on. But if not, I certainly understand. But we appreciate all that you're doing and the information that you're doing.
I appreciate what all of you are doing. We're just doing our jobs as a healthcare center, but this is hard for everybody. So we're all we're all in this together, and the whole community is pulling together. And if there's nothing else, there really isn't anything else good about this, but that is a silver lining. It may be a thin one, but it is one.
No, it definitely is. It definitely is. So thank you again, though, for joining us. And like I said, hang on if you can. There may be more questions for you. But, speaking of kind of the psychological effect, a lot of people have said that, the anxiety, the stress of all of this can really, add to, you lowering your immune system and perhaps being more susceptible to this virus. Mr. James Burns from the Kennedy Forum, what do you say to that? What would you say are best practices?
Well, I would say that something that Patrick Kennedy loves to say, and he's our founder, that the brain is part of the body. So when you're taking care of your body, you're taking care of your brain, and vice versa. It's an ecosystem that we all live with, and try to do our best to take care of it. To Dr. Landon's point, when she's talking about get outside, make sure you get your sleep, drink water, and exercise, all those things are helping your body, and that's helping your immunity. And if your mental health is good, thanks to these things that you're doing on the physical level, then it just continues to feed on to itself. So I just can't double down enough on what Dr. Landon was saying about those physical things really helping the way that we're feeling mentally as well.
I agree. There's a lot of, I think, anxiety, and I think kids, especially, things we take for granted that they're thinking about missing graduations,
Mm-hmm.
missing their friends, their lives kind of changing, although they were prepared for this kind of technology gap, I must say. But what would you say, to parents, to young folks, just how to deal with this new reality?
Yeah, so I think that first and foremost, we need to understand that stress is natural. Like as we have this uncertainty and this fear, and our stress goes up and our anxiety goes up, it's really natural for us to feel this way. So that's okay. We should just recognize the fact that there is some stress, and we shouldn't be, we shouldn't feel like we're being weak if we have this stress and this anxiety. But we just want to be mindful of it as our lives have changed pretty dramatically here. And some of the big things are, if there are changes in your sleeping or your eating habits, or you do have this heightened anxiety, or if you have physical symptoms or behavioral changes. And some of the obvious behavioral changes are increased usage of alcohol, or tobacco or other drugs. Just being mindful of the fact that this is natural, and we are all going to respond in ways that are unique to each of us. But how do you combat that? Is by recognizing and embracing the fact that this is, in fact, something that we all experience, and then finding healthy ways to cope with them. So self-care, this physical component, because the brain is part of the body, is going to be really instrumental. And then the thing that my family is working on really hard, and I hope nobody can hear, but there's pots and pans banging in the background with my 3-year-old who's at her wit's ends. We want to try and keep a routine, because some of us have lost our self-worth, I think, with our jobs being gone or our jobs changing so dramatically over the past few weeks. I mean, the rug pulled out from under us. And what is our normal? And at the Kennedy Forum, we provide trainings to community stakeholders across the West and South sides. I can't do that anymore. So that's why I got into this work. And now that I can't do it, how am I fulfilling myself professionally? Well, luckily, I'm able to do things like this, and we've been able to host webinars to talk about ways to manage your stress, reduce isolation, and improve your self-care. But maybe everybody else doesn't have the same circumstances that I might have. So creating a routine in your home, though, can help you maybe find that groove, find that productivity that you may have been missing that first week when COVID really became a thing. And also, it helps to give some structure to the family unit. Like I think many of us are experiencing what I'm experiencing with 2 little ones at home. Some people have kids who are in school and they're trying to learn. If you have a routine, then you can begin to understand the ebbs and the flows. You need to be sure that you are waking up at the same times, you are going to bed at the same times, you're getting your showers in, you're doing things for fun as well. This is fun, actually, for me to do the Zooms with a bunch of people. Find times to do these things in order for that morning to nighttime grind that I think, is a real grind 3 weeks ago. Now it feels a little bit more familiar. So that can be really helpful. That's probably my favorite thing to do, is just find that routine and stick to it and tweak it as it goes. Of course, it's going to change.
Right. Well, I appreciate that feedback. You touched on isolation, which, there are some people who are in total isolation because they need to be. And there are others, who are kind of in homes and isolated. How do you combat kind of that feeling when we're supposed to kind of be, more isolated? What are some mechanisms or things that we can do to not feel as isolated while we're in isolation, so to speak.
Yeah, sure. So, what's interesting about isolation and loneliness, that is a natural outcome from self-quarantining and working from home, is that it is really, it can have really negative impacts on your health. So much so that it can be as unhealthy as smoking 15 cigarettes a day, and also deadlier than obesity, because as your mental health declines, thanks to some of these things that we're experiencing, isolation, loneliness, that increases depression and increases suicide. So it's really easy to forget about that fact. But how do we mitigate it? We do things like this. We share information. We connect with people. I feel like I probably have a few new friends here. I know a bunch of my friends are hanging out on the webcast, and they're gonna give me a hard time about this when it's all said and done. But connecting with individuals and family members through these new this technology that we're all familiar with now, or at least we're becoming familiar with. Just the other day, my family, there's a bunch of young kids, mine own included. We had a Zoom dinner, right? And we had propped our laptops up on our kitchen tables, and we all ate, and the kids screamed, and it was a great time. So those are some ways that we can cope to really work through the isolation and the loneliness, is just connect with other people using these things that are in our pockets, which we're really lucky to be able to utilize at this time.
Yeah. And exercise too, right? I mean, we should probably find ways to exercise, get outside. What are some things, what are you hearing about that? I started exercising again, and I, felt the best I'd ever felt kind of during it. And now I'm trying to at least get my 10-minute run in every day. So what are your thoughts there?
Yeah, I'm with you. If you're lazy, by the way, I do a 7-minute exercise, which is great.
Right.
My 3-year-old does it with me, but doing anything just to stay active, and I think Dr. Landon touched on this too, just staying active is really, really important. And also, there's ways to make 2 and 2 make 5 or 6 here if you are exercising virtually with your gym. I know that Cheryl Potts, our executive director, she does virtual workouts with her gym. I think it's on Facebook or something like that, but she is able to get her exercise in, which is incredible for her physical and mental health. And then she's able to connect with the people that she sees or used to see face-to-face on a regular basis. She gets to see them virtually now. So, getting those things kind of all at once, then you're really, cooking with gas, as they say.
Cool. Well, thank you. Thank you very much. We appreciate you being in here today. Our mental health, as you said, and the way you put it in context statistically, is probably one of the best things, or the best things that we can do to mitigate this virus, is to keep the anxiety down and to make sure that we're kind of mentally sound. So I really appreciate you being here and giving us some insight. And then, where can people call just if they're feeling anxiety? Do you guys have, a hotline? I also know, a couple other local resources, but is there a number you can give folks if they're feeling, a little anxious and want to talk to somebody?
Yeah, sure. So, of course, Google is a great resource for you. There is the American Foundation for Suicide Prevention hotline that is a great resource. I can put it in the chat here as the other people are going. You can also, there's a crisis text line that you can text. Both of those circumstances, there is somebody on the other end who is going to respond. And then NAMI Chicago has a helpline that you can access here in the city. And there's a trained professional on the other end of that line who can help you if you're feeling anxious or stressed, or something more serious like suicide, or if it's a loved one. So these are 3 great resources that people can utilize right now.
Right. And I know of the Turn Center locally that operates in the Bronzeville area, led by Pastor Chris Harris and Pastor Neil. Kind of a non-traditional look at mental health, but certainly one I think that people should reach out to if need be too. That's the Turn Center. Well, thank you, James,
Thank you.
uh,
Thank you, Alderman King, and everybody. I really appreciate it.
being here today. I know we've got a lot more to cover during this town hall, and we've got some state representatives on the line to kind of give us, our outlook in terms of the state funds, kind of an overview of the state in general, food, what we're doing in terms of food and resources. And just in general, what's going on in Springfield, what are some of the resources that are coming out of Springfield. So joining us now, I'll introduce everybody and then give everybody a chance to kind of give a brief overview of what they feel are some resources and best practices for our listening audience. So we've got Representative Cam Buckner joining us. We've got Representative Sonia Harper joining us. We've got Representative Lamont Robinson joining us, as well as Miss Ivy Hart, who can give us some more detailed feedback on how to actually get these resources. And so, Representative Buckner, we'll start with you. Kind of give us an overview of the state in general. What's going on?
Thank you, Alderman King, for putting this together. So I'll just give a kind of broad brush overview of what's happening now. Obviously, we all know by now that Governor Pritzker did extend the stay-at-home order for the state of Illinois. At this point, it's going to go until April 30th. Along with that, he also extended the disaster declaration. So while that part may sound duplicative, the disaster declaration is necessary for us to get a lot of the federal funds, a lot of the federal resources that we need in order to, see our way through this crisis. We talked a little bit about the schools. Schools are obviously still closed, but what the Illinois State Board of Education has done is allowing the school districts across the state, including CPS, to implement whatever kind of remote programming or e-learning they can put into place to make sure that the children don't have to make up days at the end of the school year, right? So that the school year is not prolonged once we get out of the woods on this thing. The extension of the stay-at-home order is really based on, or really focused on us continuing the social distance so we can flatten the curve, right? We know that our public health hospital system is strong. We know that our private hospital system is strong. I have the pleasure of representing both University of Chicago and Northwestern medical centers. And what we're seeing is right now across the state, about 59% of adult ICU beds are occupied, and about 35 of those are from COVID patients. We're also seeing across the state that about 32% of the ventilators in the state are being used right now. So, the stay-at-home order and us flattening the curve is really about us not overburdening the healthcare system in the state, and we can't hammer that home enough. I'll also say that the governor mentioned today in his press conference that as soon as medical supplies and PPE are coming in from Washington and across the country, that the state is sending those right back out to the hospitals and the counties across the state that need it. So 56 of the 102 counties in Illinois have seen COVID cases. But as soon as that stuff's coming in, it's going right back out.
Okay.
I'll also say two more things. Senator Durbin talked a little bit about the temporary hospitals that are being opened or built. So right here in the 4-4, right, McCormick Place is going to have 3,000 beds to house COVID patients. There's also a Sherman Hospital in Elgin, Metro South in Blue Island, and then Westlake Hospital in the west suburbs. And then the last thing is that the governor announced today that the state has commuted the sentences of all pregnant women who are incarcerated in the Illinois Department of Corrections, and all folks who have been deemed to be non-violent offenders. Now, what that actually means in real life, I don't have what the definition is, but practically, folks who are either first-time offenders or offenses that did not involve the harm of any other people, those folks have been had their sentences commuted, just in order to make sure that our prison system in the state is not becoming a hotbed for the spread of this infection as well.
Right. Thank you, Representative Buckner. We're going to just come back with questions at the end, but I want to now turn to Representative Sonia Harper, just to kind of give us your perspective. I know food security is something that you are passionate about, and how does that impact us now? I mean, obviously there's some very obvious things of how we are using food and the impact that it has, but can you speak a little bit to that, and then some other things that you might impart on us?
Sure, and thank you so much, Alderman King, for having me today, and thank you everyone for your participation in the great information that's being shared. So as the House Chairman of Agriculture and also the House Chairman of Economic Opportunity and Equity, it's always been a focus of mine to make sure that our food supply is healthy and adequate, as well as accessible and available to all, especially for those we know who are already food insecure and who live in food deserts, but as well as the overall health and success of our food and agriculture businesses. So now, during COVID-19, everyone is focused on food access, right? From residents in the city to rural farmers and other food producers. And so we just want to make sure that people know where the food resources are. Here in the state of Illinois, there have been many expanded SNAP benefits that we want to make sure that families know about. New families do qualify for SNAP, and now everyone will see an increase to the maximum benefit. So right now, it is important that people who may not have qualified in the past reapply now for benefits right now through DHS. We also have a number of other food resources, such as our Illinois food banks, our Chicago Food Depository. We have our local food pantries and soup kitchens that are still in operation, but you may want to call before you check any of those out. We're very happy to see that the City of Chicago and CPS are continuing their feeding program for students. We're happy to see that there is food delivery for seniors. So if you are in need of any of these resources, we please encourage you to please reach out. We're also looking for local farmers markets to come online. So we are also advocating for more benefits, such as the expansion of SNAP. So we're happy for the expansions that I've already had, but what we are noticing is that in order to remain in this social distancing effort, in order to get food to the people that need it the most, we want to see people who use SNAP and link cards be able to use them for online grocers. And so we have been petitioning the governor and also working and petitioning the USDA. Representative Ford also has a bill right now in the House that if we were in session right now, we could be passing that. So seeing what more we can do to expand our current programs to help people get better access to food. Before I end, I also want to let people know that we want you to continue to support our local food businesses, our homegrown businesses, our restaurants, and our food retailers that continue to support us through this time, especially our grocery stores and our farmers markets. One thing that I've always been promoting, even before being a state rep, was growing your own food. And so there's been this new wave of what's been called pandemic gardening, similar to the victory gardens that we saw in World War I and World War II. And so we do encourage folks to get their seeds and garden in their backyards or their windowsills or in a bucket or whichever way is easiest for you. Because in some of our communities, we've had to do this to take our food access into our own hands. And with all the time that we have at home, why not start a garden and take your food access into your own hands? Just a quick word on food safety. There are new guidelines out there about grocery store etiquette, food handling guidelines, and we now even see more protections and barriers going up in actual grocery stores for food workers. I'm happy to see that, and if people have more suggestions or things that they are seeing out there that we need to provide for to make our food supply more safe, please let us know. So let's continue to ensure healthy food access for all of us, especially during this pandemic, but definitely at all times. So thank you, guys.
Well, thank you, Representative Harper. And now we have Representative Lamont Robinson. So Representative Robinson, are you with us?
Yes, Alderman, can you hear me?
Yes, we can. Go ahead.
Good afternoon. Alderman, thank you again for convening us in the Fourth Ward. I just want to reiterate that your legislators, I know that we have Representative Buckner and Representative Harper on the line. We all have newsletters. Our offices are also open, that if folks are needing unemployment assistance, if there's small businesses that are needing assistance, please reach out to your folks at the state level. That's what our offices are here for, to be of assistance to you. And so please don't hesitate reaching out if you have any questions or concerns. The state is open, and our objective is to make sure that we are there for our constituents. I don't want to reiterate what my two colleagues mentioned, but I did want to mention that one of the things that we're working with the governor's office on is making sure that our safety net hospitals have what they need for our community. The governor has asked for ventilators, as we all are aware of, but we want to make sure that those ventilators go to our safety net hospitals, that folks that need them in our communities. And so we're working with the governor's office to make sure that resources are going to areas of need. And so that's a very, very big push. I will also say that not only reach out to us for services, if in fact there is a situation where folks are needing any other services around the virus, please reach out to us if there's any questions or concerns at the state level. Do not hesitate to reach out to us. We certainly don't have eyes everywhere, but that's where the citizens come in to let us know if, again, there are issues on the ground level. And so, again, I don't want to reiterate what my colleagues mentioned, but to again, reemphasize that we're certainly here to be of assistance in any way that we can.
Right. Well, thank you, Representative Robinson. And we'll get to some questions, and you guys will probably be able to weigh in a little bit. Before I bring up Ms. Hart, I just also want to say that we're going to hear from our Commissioner Bill Lowry soon, as well as our Congresswoman Robin Kelly, and those two will end out the program. So stay tuned. We're going to try and get done by about 5:30, but I just wanted to let our listeners know that those will be coming up. And then we're going to try and do a round of like 10 questions for everybody who's kind of still here, just general questions. So everybody who's still online, I know the doctor is still, I know Mr. Burns is still online. So we'll try and get to a lot of the questions that have been coming up live. But now I'd like to bring to you Miss Ivy Hart from the state, who will impart a lot of knowledge on us, as you've done for a number of our small businesses lately. We appreciate your the information that you've brought to us. So if you can just give us a little background on what you do and some resources that you can bring to bear.
Yeah, definitely. So hi, everyone. My name is Ivy Hart. I work for the Illinois State Department of Commerce and Economic Opportunity. What that means is a super long name, but overall, we oversee the state economy. So right now, all of our jobs is to keep it going, to make sure that we're stimulating businesses and making sure that they stay afloat. My specific office is the Office of Minority Economic Empowerment. We have 3 people in that office, one person, Deanna Alfaro, that oversees Latinx businesses, Matthew Simpson oversees African-American businesses, and then I oversee African-American businesses as well as women-owned businesses. But all of us are able to support you when it comes to making sure that small businesses are understanding what loans are available to them, as well as what grants are available to them. I want to speak to the biggest one right now that we are pushing for everyone to apply to. It is called the SBA disaster loan. So when Representative Buckner spoke to the declaration of being a disaster state, what that means is that federal funds can now come in to help support us in helping our small businesses. And the biggest package that came in is the SBA disaster loan. I'm about to post the link for you guys to click on. That's where the application is. And what it is that you can ask for a loan of up to $2 million, up to $25,000 without collateral. After $25,000, you would need collateral. And the reason why I think this is such a great loan program is because it's not even really a loan. And you can say that I said that. And that's because the first payment is in 12 months and your repayment term can be up to 30 years. And they've never written policy like this before, but ultimately what they're saying is if you speak to what your financial loss is in this time that COVID is happening and your businesses are shut down, ask for that amount of money in the period of time that, let's say it's 2 to 3 months at this point, if we just look long-term, and that's a quarter. You can look at your past quarter, January through March, last year's quarter, and then ask for that amount. And our office fully believes that in 12 months, when you're making your first payment, not the full payment, your first payment, you should be able to make that first payment in 12 months. And then the full thing isn't due for up to 30 years. So it's a really, really progressive loan program. And also they just made a change, and that starts tomorrow, that if you apply for this loan, you get an advance of $10,000 within 3 days. And whether you qualify for that loan or not, you get the loan or not after the process, you do not have to repay that $10,000. So it's the best program for getting that quick stimulus of money right away, especially since it's $10,000. It's basically a grant because you don't have to pay it back. And then if you do get the loan, you get the full amount you asked for, like I said, up to $25,000 without collateral, up to $2 million with collateral, and then your first payment's in 12 months. So the application I put right down there, the terms for small businesses, it is 3.75 fixed, and that's a fixed interest rate, super low. And then for nonprofit, and it's specifically private nonprofit, so not tied to any local governance, is 2.75 fixed interest rate on the loan. So it's just a really, really great program. I'm telling everyone to apply as soon as possible because it's a federal program. The loan can take up to 21 days. The $10,000 advance is supposed to be within 3 days, but the loan could take up to 21 days. So I just want to make sure you're getting your money as fast as possible.
Great. Well, thank you. And with that, we'll just open it up for a couple questions. But just as a follow-up, Ms. Hart, how quickly? Let's just say I apply today. Mm-hmm. Let's just say for a $10,000. Did you say that was a grant or a loan?
So it's part of the loan program, but it's essentially a grant that they give you as you're waiting for your loan to process through.
Right.
Regardless if you get approved for your loan or not, you get to keep the money. You don't have to pay.
I'm typing right now, and I'm going online, and I'm applying for this loan, and I've gotten all my documents and paperwork in. How long will it take for me to get that $10,000 grant?
So it's 3 days. It's 3 days. I want to be clear with you, though. This is federal government, so it starts tomorrow. And just let them get everything, their process together and everything. So I would say in maybe a week, it should be right on par. But they're still putting the processes in place. Same with the protection, payroll protection program that we put into place. A lot of people have been running to the banks. Mm-hmm. They're not ready yet. But if you give them time to set up, then everything will be going as it should with the time periods.
Right. Thank you. And then just one follow-up in terms of, we don't have unlimited resources, but that stimulus package had a lot of zeros behind it. Do you see it's first come, first serve, I would assume, right? And do you see us running out of money or, and speaking of money, we'll also talk about some follow-up packages. I know Congressman Robinson is on. We'll bring her in a second. And I also know Commissioner Bill Lowry can also talk about the county as well. But give us an idea of what you think the resources are like now.
So what the trends are looking at is that people are actually not asking for the full amount when it comes to SBA loan, only because there is the City of Chicago loan that just went live. The state has a loan for outside of the City of Chicago, and then there are like a lot of grant programs. So in this area, University of Chicago has a grant, Verizon just dropped a grant, Facebook's coming out with one.
Right.
So there is a lot of things going on. So the state is just trying to find its place. So because of that, people are actually not asking for the full amount they need. I don't know if that will change, but that's the trend we're seeing right now, that it's viable. People we will have enough.
Right. So I want to bring into the mix Congresswoman Robin Kelly, as well as Commissioner Bill Lowry, and then we'll get to these questions. But speaking of resources, both local and nationally, Congresswoman Robin Kelly, what's going on? I know we've passed a stimulus package, and I also know there'll be a follow-up stimulus package. Can you speak to that a little bit?
Right. I'm sure Senator Durbin talked about the third package that passed, but we are working on a fourth package now. And what we're trying to look at the fourth package as recovery. We're talking a lot about infrastructure needs, and not just roads, bridges, and those kind of things, but infrastructure for hospitals, broadband, looking at the electrical grid, just the things that we've actually needed for a long time. And we're figuring this is a way that we need to take advantage, if I can put it that way, and what we need to improve. Let's use the money to do that. And also it will put people back to work. Two things I did want to say. I was on a call with FEMA this morning that in the last week, 750 ventilators were delivered to the state of Illinois. And I just checked with one of my colleagues on ag, and for now, you can use SNAP online. So just wanted to put that out there.
Great. I know Representative Harper was speaking to that earlier. But
Right. But I thought initially she said that you couldn't, which you couldn't initially, but I guess for this period you can. I wanted to double check with one of my colleagues.
Okay.
So we're kind of looking forward, and what we can do when this is over, but we're trying to work on it now. And then plus we still have to go back and finish all the appropriations bills on top of what we're doing in regard to the coronavirus. We are looking at, everyone received, or if you made less than 75,000 or between 75 and 99,000, a certain amount of money. And we are looking at putting more money into that pot also. And we're hoping that, businesses, since we're backing them up with the people that they've laid off, that they use that money to pay those folks, and then not so many people would have to be on unemployment. So there's so many things we're looking at. I've been on so many calls, from the State Department, FEMA, from committee calls, and on and on and on. But we're trying, and we're working. We are working hard.
Well, we appreciate that. I know when we were talking to small businesses earlier, was it this week or last week? My days are just blending together.
Oh, yeah.
And you guys had just passed the bill in the House, but you hopped right on a call, and we appreciate that. And I know the small businesses that were on that call appreciated that. Let me bring into the mix Commissioner Bill Lowry. Commissioner Bill Lowry is in his first term with the county under President Preckwinkle, who's the president of the county board. Commissioner, how do you see county resources kind of fitting into the mix of what's going on?
Well, first of all, Alderman King, thank you for your leadership. You're a wonderful alderman. You're also my alderman, so I really appreciate it. Before I talk a little bit about the county, let me just say, in follow-up to Representative Kelly, that we now have made available to us the Federal Public Assistance Grant Program. And this is a way for municipalities to get reimbursement relative to their COVID-19 expenses. So I think this is just another way that we can try to provide for those in need, and do so in a responsible way as different units of government. So that's very important. Relative to the county, I want to focus on something that I think is very important, and that's how we can keep some of our resources in our pockets. And I want to focus on the fact that Cook County is suspending the home rule tax program until at least May 1st. And this is fluid, as we all know. So I would have to guess that I think this extension will go beyond May 1st. But what we're talking about is a suspension of taxes relative to county taxes pertaining to our home rule power. We're talking about the alcohol beverage taxes being suspended, the amusement tax, tobacco tax, hotel accommodation tax, operations tax, use tax, and many others. Also, late fees will not be assessed for liquor license holders as long as their license is renewed no later than July 31st of this year. Also for our small businesses, and I enjoyed hearing Ivy reference the import of them. You know, this city, this county, this state, we're really buttressed by small business. So Cook County will just extend for 6 months the certifications that our different business enterprises have. So our business enterprises do not have to worry about the fees associated with or the time associated with recertification for 6 months following where their individual certification would run. The other thing I want to point out is relative to the county, there's a hotline number if there are any issues that come up. The hotline is 708-633-3319. The email is ccdph.covid19@cookcountyhhs.org. And then if you want to text and get an update, you text alert cook, one word, to 888-777. Along with that and my website, commissionerlowry.com, you can find out anything relative to how the county is responding to the COVID-19 pandemic. And I'm here to help at any point, and I appreciate, again, your leadership.
No, thank you. Thank you, Commissioner. So I know there's a number of burning questions that have come up. One of the biggest ones is really about unemployment and unemployment benefits. Can somebody speak to how to kind of access unemployment benefits? I don't know, is that a state or a federal resource?
So it would be IDES. Part of that is in the CARE Act. There is like an expansion of that. But if you just email me at IE.hart@illinois.gov, I can get you a direct link to your specific situation.
Yeah, and I don't know if Congresswoman Kelly, can you speak to the act on that specifically in terms of?
I'm sorry.
Go ahead.
Well, everyone that gets unemployment, they should also get an additional $600 added to that. And, I know that, they should get 600 increase for everybody. And we waived the waiting period. So to get money in people's pockets even sooner by providing federal incentives for states to eliminate the waiting weeks. And then there's an extension of benefits, an additional 13 weeks of federally funded unemployment insurance benefits. And then there's an allowance for people who are really concerned about part-timers, self-employed, the gig economy workers, but they also, they have access to it also. And just people that get 1099.
Great. I actually thought this was a really good question, Mr. Burns, and it's directed, towards kind of mental health. But just talking about the, domestic violence, and I think how some are saying that, it's increased during this time. But can you give, maybe some resources or suggestions to that end?
Yeah, thank you for that. I was just actually doing a little bit of research myself, and I began to type the response to Lakshmi here. I'm not 100% familiar. This is not an area of expertise of ours at the Kennedy Forum, but I'm going to do some research, Alderman King, if that's okay, and maybe we can share out with folks, because I have heard this previously. People concerned who are in relationships where domestic violence is a reality for them, and they can't go out and maybe have that escape. So I'd like to do a little bit of research and connect with the subject area experts and see what they have to say, and we can check that out.
Okay, well, thank you. I appreciate
And Alderman,
Yes.
the other thing is my stepdaughter does 911, and she said, like, I don't know if it was the first or second night that we had the shelter in place, those were the majority of her calls.
Yeah, domestic violence. So it's real, and so we should try and provide some answers.
Alderman, if I can chime in real quick, because I just had a phone call earlier this week about both the influx in domestic violence cases and in child abuse cases. The Illinois Domestic Violence Hotline, and I'll put it in the chat, but it's 1-877-863-6338. I'll put it in the chat, but they're asking folks if they have issues to give them a call, and they have a plethora of resources to be helpful.
Great. No, thank you. Thank you. That's definitely an important question. So I'm glad that that was brought up here. Another question that has come up is kind of mortgage assistance. You know, people are wondering, you know, during these nimble times, you know, do I pay my mortgage? Do I have to pay my mortgage? Has anybody heard any feedback on kind of mortgage assistance or relief?
Yeah, so I mean, the SBA is also doing home loan relief. You don't have to pay it right now. Everything's being deferred. Also with rent, you don't have to pay it right now. If there are people who are saying they're gonna penalize you for not paying your mortgage, it's gonna hurt your credit score, or they're gonna evict you, all of that is officially illegal. So we have different helplines to call. I'll find the link and I'll send it in here. And then I also have a Q&A sheet about it that I can send to Mac to send out.
Great. Great.
And also, just to add, we're looking at, again, under the leadership of Maxine Waters, we're looking at other things that we can do in the next stimulus bill. There were some things we got and some things we didn't. So we're still looking at what more we can do, not only for public housing, but housing in general.
Right. And Congresswoman, while we still have you, you know, that trailer bill that you're talking about, what's the timing of that? And then are you still trying to kind of assess what the needs are before you write that? How is that going?
Oh, I mean, we're working on it now, but, you know, there's things we wanted already that we couldn't get in. So we're going to try to put those in again. But then we're listening, you know, to what people are saying. So many of us have had town hall meetings. I've had 2 small business meetings. I'm having a meeting with my mayors, with my pastors, you know, with my school superintendent. So all of us are doing that around the country. The different caucuses are doing it, like CBC is going to have a town hall meeting. So yeah, we're hearing from people, and then and their experiences, and we want to make sure the money is going where it should be going. So we're taking input.
Great. Well,
but you know, we want, you know, the problem is we're not there, and the whole issue of, you know, flying back and forth and you know, how many of us can gather and those kind of things. So we still have to deal with that, because no matter what we come up with, we still have to go back to DC to vote.
Right. Right. No, I think that's a new reality that we're all dealing with, whether it's at the city, the county, or the state. You know, how we can move important legislation forward during this time, especially because it's impacting some of the most vulnerable. I mean, any crisis we have tends to impact the most vulnerable exponentially. And so we've got to make sure, you know, that we course correct. And I appreciate, Congresswoman, that, you know, you've been calling and trying to understand what we need locally and, you know, implementing. I've seen some things just go up, and I know that that was because of the work that you put in. So I appreciate that. And just everybody, on this call, I know we could go on for another hour, but you know, in the interest of people's time, I think we covered a lot in a very short period of time. But you know, I'm so grateful for our panelists here. And so I just want to thank you all, you know, for giving of your time today, for sharing.
Thank you.
Thank you.
Thank you.
Have with the audience, as Senator Durbin started off with, you know, we may have so many participants on this show or this platform right now, but you know, with social media, you know, people are really hungry for information, and us as leaders are hungry to make sure that our small businesses, our vulnerable seniors, our you know, kind of everybody in this instance, but there is kind of a hierarchy of people that we need to get resources to sooner than later. And I know that, you know, everybody on this call is willing and ready to do so. So I just appreciate that. I just wanted to go down the list and thank all of the panelists here. Before I get to that, I'd be remiss if I didn't thank our governor, who is doing an excellent job and showing leadership. Our mayor, Lori Lightfoot, is showing tremendous leadership during this time. The president of the Cook County Board, Tony Preckwinkle, is showing great leadership. And, you know, I always say, you know, leaders will lead. And it becomes evident during times of crisis. So I appreciate that. But I also appreciate, you know, everybody on this virtual town hall, beginning with Senator Dick Durbin, who joined us earlier, Dr. Emily Landon, an epidemiologist at the University of Chicago, Felicia Sanders, District Chief with Chicago Public Schools. Thank you guys so much. James Burns with the Kennedy Forum. I appreciate you tremendously. Mental health is certainly a huge part, if not one of the most important parts, to mitigate getting this virus. State Representatives Sonia Harper, State Representative Lamont Robinson, State Representative Cam Buckner, thank you so much for being part of this. Ivy Hart with the state, you've been imparting just a lot of knowledge, and we appreciate you coming and sharing that with this forum. Also, my great friend, Commissioner Bill Lowry, thank you for joining us. And Congresswoman Robin Kelly, it's no secret that you're a great friend, but just a great resource. So I appreciate all of your time, and I know that your phones and emails are full, and so just want to say thank you on behalf of all of your constituents and colleagues. I know you're doing an awesome job, and very harrowing time, so thank you again for being here. I'd also be remiss if I didn't thank my staff, my chief of staff, Prentice Butler, my director of communications and legislation, who is putting, you know, kind of producing all of this, and he's kind of laying low in the background. But Mackenzie Thurman, thank you. My director of constituent services, John Wallace, and my executive administrator, Paula Klein. Thank you guys so much, and thank you everybody for joining in. If you need answers to a number of the questions, we will email those to the participants. You'll be able to view this again, I believe, on Facebook or Zoom. I am definitely coming up to speed on technology. So forgive me if I'm giving you some wrong information, but I believe you'll be able to view it again on Facebook. But thank you all. Thank you for joining us. And, you know, be safe and take some time, as Mr. Burns would say, to be happy and celebrate during this time as well, because we know our mental health is most important. So thank you all.
Complete
Thank you, Alderman. Thank you.
Complete your census. Thank you.
Thank you.
Thanks.